Good evening, everybody. Dr. John Slippy here. Thank you for joining us this evening. We are so excited for this announcement. If you've been in office recently, you've probably heard me talk about this new technology that we've been waiting on. We have been wanting to have this here for months, and it's been delayed by several unexpected delays. But what we have to announce is that we have this new breakthrough technology. It's called IHHT, which stands for Intermittent Hypoxic Hyperoxic Therapy. What's really cool about this is it's number one, it's very new. The doctors that invented it won a Nobel Prize in medicine in 2019, and I think the pandemic probably delayed its implementation. You've probably never heard of it before because it's very new to the U.S. and it's very hard to come by, which is why we wanted to bring one in-house. So this technology is used all over Europe. There's over 3,000 clinics in Europe using this with great success for a myriad of issues. And for us, it's been like waiting for the internet to arrive to the United States, just waiting for this technology to get here. IHHT is an established technology. This machine pairs it with, it's almost like AI technology where it's actively monitoring your biometrics, your heart rate, your blood oxygen levels, and it modifies the treatments as it's going along. So that's why this is uniquely special and highly effective. The only other clinic in the U.S. that has one of these is on the West Coast in the Las Vegas area. So what is it good for? It's considered cellular energy technology. And the reason why that's important is our bodies are comprised of cells of various types. Like vehicles on the road, they all have tires, they all have engines, they all have windows, but they're all for different purposes. Our bodies and our cells all have different functions, but when they're dysfunctional, we can feel it in a number of ways. So if you've been dealing with long COVID, long Lyme disease, post-viral syndromes, if you've had multiple concussions, if you've had a stroke, if you're just tired and you're not sure why or you feel run down, athletes who are looking to maximize performance, getting cells to function more efficiently, optimizing the mitochondrial function, which is the powerhouse of the cell, getting all that to work optimally has a profound impact. So technologies like this that we're bringing into our wellness center here at Living Well, the driver of that is our functional medicine patient base and the things that we're seeing presenting. Knowing that there's technology and resources out there that could be helpful, but having a hard time finding a place to send patients. Since we can't find anywhere that has this technology, we brought it in-house. So super excited. Again, if you've been in the office anytime in the past 4 months, you've heard me talking about this with anticipation, expecting that it could be any week, any month, any day. It's finally here. So this is the machine. It's very heavy. It's heavier than it looks. And what it does is you sit in this chair, which is a very comfortable recliner, and we can put you in a zero gravity position. And this mask goes on your face. I'll move this here. Every patient gets their own mask, and it's for their use only. And this mask goes on your face, and it controls all the air that you're breathing. And I'll speak to some of the details of what that does. But if you've ever heard of a hyperbaric chamber and the therapies that are given in a hyperbaric chamber, one of the main driving functions of that is driving oxygen into our cells. So people who have severe wounds or who have nerve damage, hospitals will often use a hyperbaric chamber to drive oxygen into nerve tissue for healing. And the dangers of a hyperbaric chamber are that it's a highly pressurized chamber, and if anything goes wrong, it can be deadly, actually. So for the longest time, there's been this question of, can we accomplish some of that without the pressurized chamber? And so, necessity is the mother of invention. This technology was developed to facilitate a lot of the same benefits of that and even more in a very comfortable, non-confining method. And so, this machine will monitor, like I said, biometrics while you're getting the therapy, and then it controls all of the air that you're breathing, takes your body into a mode of low oxygen status that doesn't feel as bad as it might sound. Kind of like when you go up a flight of stairs and you just feel like you're working harder. You don't feel distressed. You just feel like you've done some activity. It controls the amount of oxygen that you're taking in, and it takes your body to a point where it's craving oxygen, and so it's optimized for oxygen intake. And then the machine can switch to normal room air or hyperoxygenated air, which then allows oxygen to be driven into into cells and then into tissue. Each cell is specific to each tissue in our body. Each tissue in our body is specific to different functions: heart cells, brain cells, eye cells, skin cells, lung cells. And cells are greatly impacted and improved in their function when oxygen is delivered. Another benefit of hypoxic therapy, which is similar to being at a higher altitude where the oxygen is lower, is your body starts to maximize the good cells, and the cells that have a weakened mitochondria begin to be managed and sorted so that you begin using only the optimized cells that have well-functioning mitochondria that are receiving all of this, eventually receiving oxygen back to normal room or hyperoxygen. I know that sounds probably very techy and hopefully not too nerdy, but I'm just so excited knowing the conditions that this can treat and address and help with, all the patients that could benefit from it, and the fact that this is a tried and true technology, and there are people who need it who don't even know that it exists. So we had a few questions I wanted to answer here. And if you have any questions and you want to submit them in the comments section, feel free to do that. So does it feel like my breathing is restricted or like I'm not getting enough air? I have had 2 treatments on this machine at a demo site, and I can tell you that you can tell that the air is being controlled, but it actually is very relaxing. I almost fell asleep the one time at the point where the oxygen was lowest during my treatment, and I could have just dozed off, and it felt very comfortable. So typically, at least in my experience and what people have said in other places, you can tell that the air is being managed, but you don't necessarily feel desperate for air. This machine, there's a testing protocol that every patient experiences before they would receive a treatment, and it helps to determine the status of the patient. How healthy are you? What is your cardio respiratory status? And is it dangerous for you to be on a machine like this? There's different modes, and the machine itself detects, based on the biometrics, your heart rate, your respiratory rate, and your blood oxygen levels. It can determine how you're doing and adjust and adapt. We also have a means to control that while it's going on, so that if we want to, we can adjust that as well. But that is the beauty of IHHT technology, which I described earlier, paired with this software technology that's in this machine that adapts in the moment to the patient that's getting the treatment. So how long does each session last? Typically about a half an hour. The pre-test can take about 45 minutes to help determine what is the best level of treatment and intensity, whether it's mild, moderate, or more intense. Again, even professional athletes can use this technology to enhance their cardiac and aerobic performance. How often should I do these to see benefits? I can tell you there are benefits right away. The amount of treatments will affect the significance of the benefit that a person experiences overall. The condition that we're looking to address will also determine how many treatments and what intensity. So that can vary, but every treatment you get, you feel the benefit of that treatment. Let's see. What if my body can't take the low oxygen percentage that the machine is programmed to? Part of that is the pre-test evaluation. If your body shows that it's not going to respond well to a low oxygen status, the machine will not take you as low. If you are feeling a sense of, for any reason, like it's too low, the machine will detect your heart rate and detect that you're feeling some stress, and it'll adapt. We can have it adapt automatically, or we can step in and adapt it as we're monitoring this on a screen. This can be monitored from anywhere in the world through the internet by us, or there are even professionals that are associated with this company that we can hire to monitor and give even professional medical insight. So a lot of options there. We have a question: how many treatments are suggested? I would say everybody should give it at least 6 treatments to see what it does for them. Whenever we have a therapy, we have several therapies at the Wellness Center that are intended to be somewhat repetitious, but with a fixed number. And the whole point of that is we want you to experience what your body's doing with it, and you can typically have an innate sense of, I'm seeing the benefit, I'm seeing the improvement, I think I want to continue this, or I think I've leveled off, I think I've plateaued, and this is about as good as I'm going to feel. So yeah, I would say at least 6 to really give it a good shot and see what it can do for you. But I'll tell you, I had 2 treatments. It's not typical to get 2 treatments within 24 hours, but I went to the site and visited, and I got 2 treatments within 24 hours. I was feeling the physiological benefits of it for a good 3 weeks, and I'm not exaggerating. And the best I can describe it personally, again, I can't guarantee that this is going to be the case for everybody, but I felt like I had more access to my own brain, thinking clearly, feeling like a good, if you've ever had a good coffee day where you don't feel jittery, but you feel like alive and alert, and your mental faculties are as good as they've ever been, that's a good coffee day. And I felt like that times 10 for a couple weeks. So I'm looking forward to using this regularly. That's one of the perks of working here. I think all of our staff are very much looking forward to using this as well. Let's see. How far apart are the treatments suggested to be? On average, I would say probably twice a week. There's no harm in doing it more frequently. Again, I don't know that I'd recommend twice in 24 hours because it's probably overkill. Yeah, at least twice a week to start would be a good idea. Again, the pre-test is going to give us a good assessment on what would be best for the patient. Also, the condition we're trying to address would also determine the frequency. So it will vary case by case. Let's see, how would someone know if they benefit from it? Well, we want this to be used by people who need it, but it's fair to say that everybody could benefit from it. I mean, I got my 2 treatments without any conditions that we were going after. I just wanted to see what it would feel like, and I can't wait to do it again because I felt amazing. I slept amazing. You just kind of feel like you're winning at life, and that's just baseline, like no issues, and just benefiting from the cells being optimized. So, and the neurological, the benefit to nerves, when you translate that into mental clarity, patients who have memory issues, patients who are aging and are starting to forget things. Um, if you've had concussions and you just know that this isn't right, or you feel like the brain fog won't entirely leave, that is one of the slam dunks that this technology can really help with. So again, I'm getting away from myself, but yeah, so it really does depend on the condition of the issue we're trying to address. Um, has this been used for POTS or dysautonomia symptoms? Yes, it has. So POTS kind of falls under the umbrella of the hypermobility syndromes and um, blood vessels that are, they struggle to maintain tone, to maintain blood pressure, and the dysautonomia of low blood pressure. Um, that has far-reaching effects in terms of getting oxygen to places. When you think about POTS, that what happens is your blood pressure drops very quickly uh, based on your position, sometimes even without changing position, just moving a little bit and not necessarily even standing up. If the blood pressure can't keep up, you feel lightheaded and dizzy, nauseous. Um, but the challenge with that is blood is not getting to the brain, and getting more oxygen. The blood is supposed to transport oxygen to the brain. Getting more oxygen to the brain, getting more oxygen to your blood vessels and your entire system, profound impact. Um, will it cure POTS? That's a broader topic, but anything that you're going to do to benefit your cells is going to benefit the issue that you're looking to address. So again, this has been around since the late, um, late 2017, 18, 19. I think the pandemic probably slowed things down, but the more it gets used, I'm sure in the U.S. market, we're going to start to be able to see a lot more uh, clinical application and outcomes. The National Institutes of Health, anybody watching this video, if you Google IHHT and NIH, National Institutes of Health, you'll read scenario after scenario and condition after condition that they have studied, and everything they throw at this technology gets better. And it's fascinating to read one thing after the next, and they're not done. And so that's why for us to know that this technology exists and be waiting for it, it felt like waiting for the internet to come to the United States. So excited it's here. Another question. Does this treatment have impacts on the root cause or the symptoms of people that deal with mental health challenges like depression, anxiety, ADHD, etc.? 100%. Mental health, the whole behavioral health arena has different nuanced sub-levels. And there can be different root causes of some of those symptoms. But a lot of them are based in neurology. A lot of them are based in neurotransmitter activity. And neurotransmitters being generated, neurotransmitters being utilized at receptor sites, all of that is a cellular activity that is impacted greatly by lack of oxygen getting to the cell or improved by more oxygen getting to the cell. One way to kind of frame a lot of this, if you think about a virus, and it's not exactly on topic of the behavioral health, but might help to give a better understanding of how this applies even to that area. When somebody gets a virus hijacks cells, and it uses that cell then to become a manufacturing facility for that virus. So that's why viruses can be so systemically debilitating. Bacteria are themselves a type of organism cell that can be hijacked by a virus. All that to say, when a cell is impacted by something, it has a huge impact on the whole system. And so things like long COVID, long Lyme, mono, or Epstein-Barr virus that has a long, protracted cascade of symptoms, it's because the cells are trying to recuperate from having been hijacked and utilized for viral replication. And when you optimize the function of the cell back to how it should be, it fast forwards and helps that recuperation recovery to completion. And that's where this technology is so helpful for anything like that. So if you understand how cells can benefit from this, the more you think about it, the bigger this gets and the applications get. And again, it seems like anything that we throw at this technology from a health standpoint improves substantially, because the way we feel, the way we function is cellular. Every cell of the body. Cancer is a cellular problem. It's replication of cells that don't know when to quit, don't know when to die off. They just keep reproducing self-replicating cells. So since so much of our physiology is cellular, when you have something that enhances the function of good cells, even immune cells, it's just an endless array of possibilities. So that's why we're super excited about it. We're going to be posting this video to our website. We want people to know that this exists. It's hard when you know of something that is so helpful to so many things for so many people, and it's so new that nobody knows about it. And so we just can't wait for people to know about it. If you think somebody would benefit from this, please visit our website, send a link to our website to them. We've tried to revamp the entire website so that information is easily accessible. We even have an AI chatbot now on the website to help take you to the information you need without you even having to know where to go. You just ask the AI chatbot, it'll take you there. But we want people to know that this resource and the other resources in our Wellness Center are available. And we've gone to great lengths with the new website to help that information be easily accessible. So please share this with anybody who you think is struggling with any of these issues. Again, I could probably talk for several hours. I'm so excited about all the issues that this can address. Feel free to reach out to the office if you have any questions. We want to answer any questions you might have. We're going to start scheduling patients for the beginning of November, meaning we're scheduling them for the beginning of November. Later this week, we're going to start calling people who have put their names on the wait list, who wanted to know when this was going to get here, and we're going to start scheduling them for the beginning of November. So if you're interested in trying this out, or if you have any questions, feel free to call. But we just can't wait to get rolling with it, and we can't wait to see people's lives changed by this technology. So thank you again for joining us. We appreciate your time, and thank you for entrusting us with your care, and God bless. Have a great evening. Take care.